Thank you for this opportunity. The aim of our study was to compare the outcome of dual tear in open versus minimally invasive spine surgery in patient undergoing surgery or degenerative lumbar pathologies. 420 operated cases with a follow-up more than 6 months were included in the study. The cases were divided into open and MIS group depending on the type of surgery they underwent, and various parameters and demographics were compared between the two groups. The mean follow-up for our cases were 18 months. 156 patients underwent MIS surgery, while 264 patients underwent open surgery. The age distribution, sex distribution, and comorbidities were comparable between the two groups. The incidence of dual tear was significantly high in cases of high BMI and diabetes mellitus, irrespective of the approach to surgery. The incidence of dual TOMY was 12% in our cases. On comparing the two groups, the incidence of dual tear was significantly low for MIS group, 6.4% compared to 15.7% in open surgery. The incidence of dual tear was high in open cases, irrespective of sex distribution. The incidence was slightly less in male, but this difference was statistically not significant. On comparing the incidence of dual tear across the different surgery, the incidence was significantly low in MIS group for discectomy and for revision surgery, but overall the incidence was low irrespective of type of surgery in MIS group. In open group, 4 patients underwent a revision surgery due to persistent CSF leak or pseudomeningeal, while none of the patients for MIS group was taken for a revision surgery. Even when we looked at the return to work after a dural tear, and it was significantly low, means for MIS group, that means the return to work was early for MIS group at 4.47 weeks compared to 6.76 weeks for open surgery. And the loss of salary again was significantly low at 45,000 rupees compared to 74,000 rupees for open group. Now, the incidence of dual tear in literature has a wide range. It varies from 0.3% to as high as 35%. Interestingly, for prospective studies, it is on an average at 10%, while for retrospective studies, it is as low as 4.32%. In our study, we found that the MIS group had a significantly low incidence of dual tear. On literature review on meta-analysis, the authors had concluded that there is no significant difference between the two groups when it comes to dural tear, but most of these studies are from a mismatched cohort and with a small number. Even in systemic reviews, when authors had quoted the lack of background patient characteristics such as BMI, small data pool, as a limiting factor in finding a more fruitful data when comparing the open and the MIS groups. 4 patients of open group underwent a revision surgery due to persistent CSF leak. We believe the loss of posterior element and paraspinal muscles increases the risk of revision surgery in open cases, while in MIS cases, due to the oblique corridor and preservation of the soft tissue, it provides a natural barrier and it decreases the chance of post-operative dural leaks and complication which might require a revision surgery. So based on our study, we conclude that minimally invasive approach can result in significantly low incidence of dual tear compared to open surgery. Even in presence of incidental dural tear, patients treated by MIS approach are less likely to have complication and revisions related to dual tear. So these are our references. Thank you. Thank you so much.